Hi, how are you?
I'm fine.
Okay, my name is Mehak and I'm your counselor today. And I use she and her as my pronouns. What's your name?
My name is Michelle and I go by she and her.
Okay, so Michelle, we will be completing an assessment tool called Drug History Questionnaire. And this tool will help me to know about your drug history, like what substances you used in like last 12 months and in last 90 days. So I'm going to ask you about some drugs and you just have to tell me like if you have used this substance in like last 12 months or in the last 90 days. Are you okay with that?
Yeah.
So shall we begin?
Yeah.
So, firstly, I want to ask, like, have you ever consumed alcohol in any form, like beer, liquor, or wine, in like last 12 months?
Yes.
Okay. And have you ever consumed cocaine or crack?
No.
Okay. And like any stimulant, like amphetamines or any other stimulants?
No.
And cannabis, like hash, weed, pot, grass, or marijuana, any of them?
No.
And what about the benzodiazepines?
Yeah, I use them.
And have you ever consumed barbiturates?
Mm, I think yeah.
And what about heroin and opium?
No.
And any like prescriptive opioids you are prescribed to consume in like last 12 months?
Yeah.
Okay. And any over-the-counter codeine preparation?
Yeah.
And any hallucinogens?
No.
Okay. Any like any have you ever inhaled any glue or any other inhalants, stuff
No.
like that? Okay. And tobacco.
Yeah.
And like if you know if you have consumed any other psychoactive drugs which I didn't mention in the drug list.
I don't think so.
Okay.
Yeah.
So that was your last 12-month window. Now we
Okay.
will be begin by like 90 days period.
Okay.
So what about alcohol? Like have you ever consumed it in your last 90 days period?
I'm not sure. I drink a couple of drinks of pretty much last night.
Mm-hmm.
But my last drink was 2 days ago. I tried to stay off it before coming in. It was not easy. I guess I did not drink 3 days right after I was admitted to the hospital because of the overdose.
Mm-hmm.
So I guess I did not drink of the 5 days of the last days.
Okay. And do you know like the exact amount on each day you consumed alcohol?
I have been drinking a couple of glasses of wine most night for about 10 years.
Mm-hmm.
It just helped me sleep and feel like a reward at the end of the day.
Mm-hmm.
I guess I drink 2 to 3 bottles a week, 750 milliliters something.
Okay.
Yeah, because I have 2 glasses each night, but sometimes I took 3 glasses with my friends on a weekends.
Okay, that sounds good. And what about the benzodiazepines? Like, have you ever consumed it your last 90-day period?
I have not used them in the last 6 months, but it was prescribed by my doctor for anxiety, so I took 1 mg tablet twice a day.
Okay. And any prescriptive opioids?
This is embarrassing, but I thought that were real perks and had overdose. They were laced with the fentanyl. That was about a month and a half ago something. This is the last time I used them. I used to get them from my friends. Before I probably took them 10 times last 3 months.
Okay, that's all. That- And what about over-the-counter codeine preparations?
I have used Tylenol one as for a migraine in the past, and they were not strong enough. I guess I have not had them in the last 90 days.
Mm-hmm.
Though lately I have been trying to manage with extra strength Advil and cold compresses. I started to using cough syrup with codeine because it takes me at the edge off. But now I think I had become psychologically dependent on it, like a security blanket for me. I drink about a half and a whole bottle, and it will be around something 6 ounces. The
Okay.
last time was 4 days ago. I took them. I probably take 2-3 times a week, maybe 30 times in the last 3 months.
Okay. So, what about tobacco? Like how much you consume in each day? Have you ever consumed it in the last 90 days?
I have been a daily smoker for the last 35 years and I have to quit or cut off in the past. I did not smoke in the hospital though, I guess 2 days there where I did not have in the last 3 months. I did not smoke when I was pregnant. I had 3 month period without it when I mostly use the patch and nicotine gum. I smoke around 25 packs and my last smoke was before I came in.
Mm, okay. So that was the end of our session. So we will discuss further procedures, or we will provide you any treatment plan in your next session, like how can we treat your situation or that. So how are you feeling now?
I'm good.
Okay, that sounds good. So we will meet in next session to continue our the drug history assessment.
Okay.
Okay, so that's it for today. Thank you.